Scientist, idea salesman, entrepreneur, they all describe tonight's Newsmaker.
This company is based in Winston-Salem, and it is one of the country's leading biotech firms. It is developing what could turn out to be breakthrough medications to treat neurological disorders, from depression to Parkinson's. But how Don deBETHIZY and his company got their start is, to say the least, surprising. In the heart of Winston-Salem's Piedmont Triad Research Park,
there are almost 1,000 employees related to biotech right here in the park, the medical school in biotech.
Is a rising star.
We're building health and restoring independence to patients.
It's no coincidence Targacept is just down the street from the R.J. Reynolds Tobacco headquarters. One of the nation's leading companies when it comes to treating mental disorders is a direct offspring of a cigarette manufacturer. You are a toxicologist working for a tobacco company. When you described what you did to people, did you often get some weird looks? And how did you overcome that?
I always got that, a weird look when I said I was a toxicologist, and people stereotyped me right away. But it's never stopped me from doing the right thing, and Reynolds Tobacco was interested in investing a lot of money in trying to develop alternative tobacco products.
Don deBETHIZY's team was actively involved in the development of RJR's Eclipse cigarette in the 1990s, which heats instead of burns tobacco, producing less smoke and no ashes. But in the process, RJR researchers learned a lot about why, from a neurological standpoint, people smoke and the effects of tobacco's natural chemical, nicotine.
Cigarette smoking causes lung cancer, and nicotine is addictive. So it's like those two issues needed to be addressed from a public health standpoint.
RJR researchers knew when people smoke, nicotine interacts with proteins on nerve cells. Those proteins, called neuronal nicotinic receptors, help regulate and normalize brain function. They also knew nicotine receptor interactions lead to two distinct positive neurological changes.
One of them is focus, that it causes you to focus better, just like caffeine does. Sure. And they're in the same order of magnitude. The other really compelling feature, and probably underlying most smoking behavior, is stress alleviation.
In other words, smoking has some good side effects. But the RJR team went on to make significant contributions to the discovery that there are actually subtypes of nicotinic receptors in different parts of the body. And when nicotine interacts with some of those, negative things happen. Most notably, higher heart rate and blood pressure, even nausea. So why not, the researchers asked, develop new chemicals that target and interact, much like nicotine does, with the positive subtypes of the receptors that influence focus, stress, memory, and cognition. Hence the name Targacept, for targeting receptors.
So we had to work on both sides of the equation. We had to design brand new chemicals that had the potential to be a drug or a therapeutic that would enhance the effects that nicotine caused, focus and stress alleviation. Enhance those and then get rid of the side effects.
Fast forward to today, where Targacept, now independent of the tobacco company, is using machines like this one to insert these new non-nicotine chemicals, the company has thousands of them, into cells to see how they interact with specific receptors.
If that receptor opens like it's supposed to,
sure,
in response to the right kind of chemical, then it'll dip down like that, okay, and then come back.
Dip, yeah.
Yeah, so something's worked.
Targacept's most exciting news involves a $200 million drug licensing deal with the drug manufacturer AstraZeneca to develop a new potential treatment for depression. deBETHIZY calls the trial results so far remarkable.
It has lower side effects than nicotine, but it has a much more exaggerated effect on depression than nicotine itself.
There's also research happening here on potential drugs to treat schizophrenia, Parkinson's, even Alzheimer's. Are we going to see a cure for Alzheimer's in our lifetime?
Cure is too strong of a word. I believe that Alzheimer's will have a multifactorial approach like cancer. Okay. We really believed, when the war on cancer first got started, people thought there was going to be a magic bullet. There hasn't been a magic bullet. So every type of cancer has its own regimen that people use. I believe that central nervous system diseases will take the same approach. We have an opportunity with brand new mechanisms using this nicotinic receptor and this unique approach to come up with superior treatment options for these complex diseases and disorders that have really gone unmet.